As fall arrives, many of us head outside to get some fresh air and enjoy the great outdoors, but September is one of the most active times for another less desired outdoor treat, Lyme disease. Dr. William Schaffner joins us from Nashville now with the lowdown on Lyme disease before we head out into the woods. Dr. Schaffner, thanks so much for joining us.
Hello, Tanya. Good to be with you.
So many of us have heard of Lyme disease, but what exactly is it?
Well, Tanya, Lyme disease is a bacterial infection that's transmitted to all of us by ticks. So there's a hazard when we go out into the woods or even work in the brush around our own homes.
And what time of the year do we need to be the most worried about this?
Well, ticks are active from the beginning of the summer season all the way through into the fall. And it depends a little bit in different parts of the country. We're down here in Tennessee, so ticks stay active until October, really.
And is that the case up along the Northeast, too? I know that certain states, Connecticut in particular, have a big problem with Lyme disease.
Sure. Well, the major areas of Lyme disease activity are, first of all, New England. There's a lot of Lyme disease there, and it extends down the Atlantic seaboard all the way down to Maryland and even into Virginia. And then there's an area up in Wisconsin and Minnesota, and then on the West Coast, Northern California and Southern Oregon. So obviously the more north you are, the earlier the ticks go to sleep for the winter.
And is there any indication that Lyme disease is spreading, or it's pretty much holding steady?
It's pretty much holding steady. Throughout the rest of the country, it's kind of spotty.
All right. Now, doctor, what symptoms present themselves in someone with Lyme disease?
So the tick bites you, and it has to be infected. And mind you, not all ticks by any means are infected. But if you're bitten by an infected tick, within the next week or so, you will develop a rash at the site of the tick bite, and it's very, very distinctive. It looks like a bullseye. There's kind of a dark area in the center, that's where the tick bit you, surrounded by a white area, surrounded by a red ring. That's the active inflammation. And that rash generally slowly expands. It's called medically erythema migrans, which means, translated from the Latin, an expanding redness.
And is that a sign that the bacteria is spreading?
Yes, that's the sign that the bacteria is spreading in the skin, and it can also, in due course, if left untreated, get into your bloodstream and circulate throughout your body.
So I guess very important then to get treated. What is the first step someone should take if they notice the bullseye? So
it's very important that if you've been out in the woods to be inspected. We'll talk about that in a moment to make sure that you haven't got a tick on you. But let other people have a look at you also, because this may occur on your back. And since it's not very painful or itchy at all, you might not even notice it. If you have such a rash, go see a physician right away. It's a very distinctive rash, and in those Lyme intense areas, physicians are very experienced, will be able to look at it and quickly make the diagnosis and give you the appropriate treatment.
Is there a chance that you could get bitten by an infected tick and not get a rash, and then therefore not be aware that the bacteria is spreading in your body?
It's a small chance that the rash won't develop, but it's more likely that you haven't seen the rash because it's someplace on your body where you can't see it unless you turn around and look in the mirror.
And so then this is very dangerous, correct? Because if Lyme disease goes untreated, what can happen?
Well, there are really two phases to this Lyme disease. Early on, in addition to the rash, you can have kind of aches and pains in some of your joints. You can develop some fever. You're not feeling so good. You can get a headache. And surprisingly, untreated, that will all go away. Now, if that happens, in about 10% of people down the road in the next several months, you can actually develop, about 10% of those folks will develop some of the complications of Lyme. And those include involvement of the central nervous system infection, or you can get a nerve palsy, often of the face. You can get some difficulty in the conduction system of your heart, and you can get arthritis, usually of the knees.
And are these permanent conditions, or can they be treated?
Well, the earlier we institute treatment, the more likely that, first of all, these chronic conditions won't occur, and you can just eliminate the Lyme disease bacteria from your bloodstream. And obviously, the longer these conditions go on, the less effective treatment will be in being able to reverse the condition.
Absolutely. All right, so doctor, let's talk about not getting bitten in the first place. Let's talk about what we have to do before we go out to ourselves and to our children. Do you advise spraying our bodies with some sort of tick repellent?
Well, that's the first and the most important thing, using tick repellent, because it's very, very effective. And they're available everywhere. They're in your grocery store, in your pharmacy. Look at the label, make sure it has DEET on it, D-E-E-T. Spray that on you, on your clothes, around your waist, around your ankles, etc. Because as you go through the brush, the ticks are sitting there at the ends of those little branches waiting for a mammal, and you're a mammal, to go by, and they'll grab onto you. So that's the first thing. And then the second is, after you've come back home, do an inspection. Look all over your body, even the parts that were enclosed by clothes, and have someone else look in the back of your hair and along your backside and your broad back, because you can't see those areas.
And if you do find a tick somewhere on your body or your child's body, there is a technique to removing it properly. Is that right?
There is a technique, and that is to take a simple tissue, grasp the tick firmly on the body, and then slowly and firmly pull, and the tick will come out. Don't jerk it, because if that happens, you'll pull the body off the head, and the head of the tick will remain. Now, here's something important. Doing this inspection and removing the tick is important, because the tick, if infected, will not transmit the Lyme bacteria until it's been in place for several hours. So that's a real important safety measure. Do that inspection. If there is a tick, get rid of the tick, and the chances are you've removed the tick before the tick has transmitted the bacteria to you.
Dr. William Schaffner, thank you so much for all those important lessons on Lyme disease. And for the latest health news, be sure to visit the health page at abcnews.com.